Adapting and Forging New Paths. What an appropriate name for this virtual conference. If there's anything that all of you have done this past year and a half, whether as EMS clinicians, researchers, educators, or local, state, or federal officials, or whatever your role, it's included a heck of a lot of adapting and forging new paths, and then adapt some more and forge a newer path. That certainly has been the case for us as well. I'm John Krohmer, Director of the National Highway Traffic Safety Administration, Office of EMS. NHTSA has proudly supported EMS since the agency was created by Congress more than 5 decades ago. Last year, like many of you, our work shifted significantly due to the pandemic. We were asked to lead a pre-hospital and 911 team as part of the federal response to COVID-19. While the timeliness and nature of our work changed, in many ways our methods did not. Whether fighting a pandemic, supporting EMS education systems, or enhancing workforce safety, our mission is always to enhance EMS systems across the nation by bringing the right people together, representing EMS among our partners throughout the federal government, supporting EMS data collection and use, and serving as a source of reliable, evidence-based information for EMS and 911 communities. Since its infancy, our work with the EMS for Children program has been one of NHTSA's most frequent and successful collaborations, a partnership that continues to grow stronger every day. In fact, most of our proudest accomplishments in the NHTSA Office of EMS, such as the 1966 EMS Agenda for the Future, the National EMS Scope of Practice Model, the National EMS Education Standards, and the development of multiple evidence-based guidelines for pre-hospital care, just to name a few, have been collaborations with EMSC. Most recently, NHTSA, along with our colleagues at the HRSA EMSC office, has supported some critical updates to several of those landmark resources. These revisions were made to ensure EMS clinicians have the education, training, and resources to serve the needs of their patients and their communities. They were created by expert panels with input from throughout EMS, including the EMSC community. And they were guided by a vision of a people-centered EMS system, as described in Agenda 2050, and based on its 6 guiding principles: inherently safe and effective, integrated and seamless, reliable and prepared, socially equitable, sustainable and efficient, and adaptable and innovative. One of those efforts was updating the National EMS Scope of Practice Model, which serves as a guide for states when determining the scopes of practice for the 4 different levels of EMS clinicians. Part of that revision effort was the development of a process to rapidly update the scope of practice model when special needs arose. That process proved very useful when a group was convened early in the COVID-19 pandemic to examine which clinician levels should be administering COVID tests, vaccine, or even treatments. More recently, NHTSA joined with the EMSC team to support the revision of the EMS education standards. These standards provide a framework for educators to use when developing curricula and when teaching the next generation of EMS clinicians. Over the course of 2 years, with a slight interruption caused by the onset of COVID, a team of EMS educators and other stakeholders worked hard to revise those education standards, along the way listening to and gathering input from hundreds of people and organizations. While the education standards have yet to be finalized, we expect to publish them before the end of the year. One significant change in those standards, specifically related to pediatric care, was the inclusion of pediatric-related content throughout the entire standards, rather than simply in one section. The team determined that for far too long, EMS curricula had limited the information about pediatrics to a short section of the course, perhaps one chapter or a couple of lectures, specifically about pediatrics, treating them as some special population that was different than what clinicians saw every day. While that helped highlight the important differences in pediatric care, it may have also exacerbated rather than alleviated the fear that many clinicians experience when treating children. The new approach encourages EMS educators to include information and training on pediatrics throughout the course, integrating it into the entirety of the curriculum, while also highlighting important aspects of how caring for children may or may not differ from caring for adults. Moving forward, the NHTSA Office of EMS looks forward to many more collaborations with EMSC. We currently are supporting the development of more evidence-based guidelines on critical topics such as pain management and airway management. Ambulance safety, including the safe transport of pediatric patients, also remains a priority. And we work closely with the EMSC program and with the National Association of State EMS Officials to ensure EMS systems have information they need to stay safe. For those of you listening who are providing clinical care in the field, please sit down and buckle up appropriately in the ambulance, both you and the patient, and use lights and siren only when it's clinically necessary. Your patients and your colleagues, and indeed your lives, depend on it. Many of you listening today are researchers or public health officials, so I don't have to explain the critical value of data. The National EMS Information System continues to improve, with nearly every state and territory collecting and submitting patient care data for patients of all ages to the National EMS database. We hope that in whatever role you're in, you take advantage of EMS data in your community, your state, and in the national database to improve clinical care. One last thing I'd like to mention. None of what any of us do would succeed without ways to share it with our colleagues, with EMS systems and clinicians across the country, and with the public. One of the most effective ways we do that is through ems.gov, where you can find more information on many of the topics I've talked about today. The goal of ems.gov is to serve as a resource to find information about federal and national EMS activities across all federal agencies, not just NHTSA. So please, make sure you're visiting the site frequently, that you sign up to receive updates from our office, and that you share with us the great work you're doing, so we can make sure everyone else hears about it. Thank you again for the opportunity to be with you today, and thank you for everything that you're doing throughout the pandemic and beyond to protect the health and safety of children in our day-to-day clinical care. Thank you.